At the Global Liver Institute, we believe it all starts with a patient. So what happens when a patient, a liver patient no less, one of the 500 million people living with conditions that often go undiagnosed, untreated, or misdiagnosed, mistreated, and stigmatized, brings the challenges of liver patients front and center? And what happens when a patient then leads a discussion with world experts in policy, research, clinical care, and wellness on ways to overcome these challenges? Let's find out today on GLI Live. Hello and welcome. My name is Donna R. I am the CEO and founder of the Global Liver Institute, and I have the privilege of being your host for this episode of GLI Live as part of our Rare Aware series. And I'm certainly proud as a rare liver disease patient to have pulled out my zebras and my stripes, all the things. I thank you. This was a gift from one of our partners, so I thank them for their great taste and their support. And I have with me to talk about transitions in care, specifically around transplantation. At least I've counted at least a triple threat from this guest, or triple assets rather. Maria Morais is a PBC patient advocate. She is a liver transplant recipient, and she is a nurse as well, an RN. And so she has much to teach us. Maria, welcome.
Thank you so much, Donna. Pleasure to be here.
Thank you. So tell us a little bit about your background and story and how you found yourself here on Liver TV.
Well, I met someone from your organization at a recent conference, and I'm so happy to have the opportunity to be here today to just further talk about my PBC disease and liver transplant sort of journey, and a journey I'm still on, because it just doesn't end at the transplant. So thank you so much for the lovely introduction. And I'm here to really talk about, my experience. I had my liver transplant in 2021, so not that long ago. So I'm still in an adjustment phase, as I know you can appreciate with your own experience. So although, and I can really recall all of the, most of the situation, but although it was a tough recovery and adjustment in the first year of healing, and trying to see the light at the end of the tunnel for a promised better quality of life, I definitely feel privileged to be able to share the story and, my learnings, and trying to inspire others living with rare liver disease. So overall, I look back and I count my blessings, and this is why I volunteer as a patient advocate and partner on issues of liver disease, organ donation, and transplantation by sharing my lived experience. So I'm 54, I'm married, and have a joyful 15-year-old. So I'm sort of an older mama. And I live in Toronto, Canada, near Toronto, practiced as a registered nurse for over 30 years. And primarily in the field of health promotion, right? Keeping people well, and in community and public health, wellness, and a lot of chronic disease prevention as a people leader of other healthcare professionals. So as a nurse who cares for others, never did I think that I'd be on the other side of as a patient.
I was going to ask, was there a lot of liver education or experience when you were nursing before your own diagnosis?
Right. So I'm not a clinical nurse. I'm more of a policy, health promotion. So, liver disease in a clinical sense was not on my radar. And so, it was really difficult as stripping the nurse piece away and focusing on it's a life-threatening disease for myself. And, being that human aspect. So it certainly changed and influenced my personal, professional perspectives on dealing with, the healthcare system, recovery, and life after transplant.
Well, one of the reasons why we launched Liver Health as Public Health was that we would be able to reach those who are doing health promotion work and the prevention work. And it wasn't until, as late as when people have their own clinical experience that they first heard about the liver or recognized that everybody who has a liver should be thinking about their liver health. And so it sounds like we have a lot of work to do. But tell me about your transplant experience and what, the time frame of it, I know is different for everyone, but just the thought process once you realized that you needed a transplant.
For sure. So, I was relatively well most of my life. And the only real symptom, so liver disease was not on my radar at all.
Mm-hmm.
And for me, it happened and progressed quite quickly. I had Raynaud's disease for, since my early 20s. And certainly in 2017 is kind of when life changed for me. I needed a gallbladder removal.
Mm-hmm.
And that was from a very large stone. And I thought this was the reason for some of my gastrointestinal issues. Mm-hmm. And so when my liver enzymes didn't come down, I learned that I was in stage 1, maybe 2 of liver fibrosis. And the idea of that, from some stomach issues and cramping to like a diagnosis in 2019 that really shocked me, with hepatologists telling me that I would need a liver transplant in 5 to 10 years. So, as if you are to imagine those of us that, have never sort of experienced such a life-changing event, to hear that from being sort of well and dealing with minor, but
Right.
manageable.
Right. And tell people what Raynaud's disease is. I know, but tell our viewers.
Yeah. So, in the meantime, my so that was 2019. Mm-hmm. And then by 2020, when, we were kind of in the entry point of COVID-19, that's the other spin for me. I started to have really debilitating and extreme symptoms of extreme fatigue, itching. I had no appetite. I lost 50 pounds. We talk about weight management, and we always, the general population wants to lose weight and all that, but losing, I had the weight to lose, and if I can't imagine if I didn't have,
right.
And so it's not always about a number, right? Like we'd look at the scale. And a lot of muscle wastage. I had severe ascites, which was fluid in the abdomen, right? And a lot of complications. So then everything was sort of reassessed, and I was diagnosed at stage 4 decompensated end-stage liver disease, which was really, really hard to take. And I was doing all the right things, like they put me on medications, and yet I progressed and I felt defeated. And until, I came to the realization that I had to proceed.
Okay. It's okay. It is touching. It's hard to access that point in time. And all those feelings do come flooding back of what it felt like when you first heard or first realized, that you needed this transplant, and such a quick transition from sort of an autoimmune disease or condition of, I had some cold hands, to maybe 5 to 10 years. And then really it was sort of 2 years you were really facing an end stage, which means you were going to die. Yeah. And so who wouldn't tear up at that? Who wouldn't have feelings about that? That's what we want people to know when they think about, oh, we just have a liver disease, or, oh, it's just a little bit of something. And this is people's real lives, and it's really very serious. And a lot of people don't have the privilege that we do of becoming advocates because they don't live long enough to do so. Yeah. So it's okay to cry.
It's a hard one, right? And then I did end up having my liver transplant in 2021, as I said, and it was a good friend of mine who donated 60% of her liver, which, you know, in the general population, that's pretty extreme to understand, and what it takes for someone to make that decision for someone else. So, you know, right now,
That's a good friend for
yeah,
one.
it's a very good. You know, and certainly we can go into talking about the wait list and all those emotions, as I know that you'd be interested in hearing about that.
It's up to you. This is your story, and I think that's one of the things I emphasize for patients who are, you know, I've had almost 30 years to digest and think about how to present my transplant story and my transplant experience, and so everybody gets to make the decision for themselves about what parts of their story they want to share and they want to expose, and the purpose for which they want to tell their story. And so it's not exploitative, it's strategic.
Yeah.
To be able to change something in the field that was painful for you so that somebody else doesn't have to go through it. Um, you know, you had the opportunity for a living liver donation that didn't even exist when I was on the wait list, and a lot of the increase in successful liver transplants are from living donors of friends, family members, church members, or total strangers sometimes, who match by blood type and weight, a few other factors, thankfully not as many as our friends in the kidney world, and then make the decision to donate a part of the liver because it does regenerate back in the donor and in the recipient. How did you hear about living donation as an option and decide to make that change, or could you sort of still be listed for a cadaveric donor as you're pursuing a living donation? How does that work? Most people don't know.
Yeah, that's a really good question. And, you know, despite being a nurse, I didn't have the concept. It's a very specialized area. And as I dug deeper, I learned more and more. But in Canada and Toronto area, we have a transplant center, and we have a few across Canada, but it's not you know, it's very limited. So I was lucky to live near one. Some people have to travel quite a bit. So at the end of 2020, I started to have, you know, as I described, some pretty severe symptoms, and the one that really, despite the fatigue and the, you know, my brain would say, Maria, get off the couch. And my body would say, it's not happening. So I was not
Yeah.
able, I was not able to function and my daily living, caring for my son, you know, all those things. So I was referred to the transplant center in Toronto, and following an evaluation, you know, the screening is really not, you know, people might think that it's extreme in the procedures and all that. They're very, you know, you have a chest x-ray, you have an assessment of your blood work, your heart functioning, you make sure that you could sustain you know, such a severe surgery. And so I was approved for the deceased donor list, and that was March of 2021. And then I was transplanted in August of that year. But, you know, I worried every day if I would get that call. I read all the materials, you know, that you had to have your bag packed, you know, you had to have your backup plan, who's going to take care of my child, who, you know, because I am and still am, was and still am central, you know, the communicator, the organizer, the mom,
Right.
the, you know, the, although my husband is extremely helpful, I am the core in the house to make things happen. So I had a lot of worries and anxiety and
Mm-hmm.
depression, and started to be on medication, and the psychological impacts that we really don't talk about.
Mm-hmm.
Talk about the physical, and in retrospect, I reflect on the psychological piece, and the physical was the physical, and because I don't have that experience anymore, I go back into the thinking about how I was mentally thinking, my depression,
Mm-hmm.
my anxiety, the brain fog, all the, the medications that we were trialing, and just to get myself in maintenance. So, um,
Mm-hmm.
yeah, I'm a pretty private person when it comes to health. We don't really air things out,
Mm-hmm.
and we're in a social world, and during COVID, I wasn't really seeing anybody. I did have to stop working because I had an
Mm-hmm.
emergency hernia repair. So most people didn't know I was dealing with such a disease
Mm-hmm.
progression, and I felt very isolated. And
Mm-hmm.
I really denied that I needed a transplant and pushed the idea away until, one of my hepatologists, during kind of a maintenance call, while I was waiting for a deceased donor, she said, it could take years to get a deceased donor. And that for me was kind of oh, I can't suffer the way
Right.
I am. I can't be non-productive. I can't be
Mm-hmm.
attached to my couch and call that life, right? As an active professional and person,
Mm-hmm.
it was very hard to take, Donna.
Absolutely. Absolutely. And I would think that the ability to seek out another path and an alternative gives you back a little bit of control,
Yeah.
gives you, a way to act. I was smiling sort of your talk about packing and getting ready because I had an emergency surgery a few months ago that left me in the hospital for several weeks. And by the time I could wear real clothes, and my husband packed some, he somehow dressed me like an Easter egg. It was, and so as I get ready for another surgery, I'm gonna pack myself. I was just we were bringing the suitcase out, and I'm like, ooh, I'm not gonna dress myself like an Easter egg. I'm gonna get to pack like a not crazy person, and get ready for this surgery. I also think about how I pack so differently as an experienced patient who's been in the hospital many times versus I don't know what I threw in there the first time, so what I thought I would need it, but
Yeah.
it's very
Yeah.
different. Sometimes it's the practical advice that we give to other patients now.
Absolutely.
How do you pack for the hospital? What
Yeah.
types of things to think about, like preparing for your children, your pets, your house, and things, because when you come home, you can't do things, and you want things a certain way, and you are the central,
Yeah.
the core and the pillar. So
Yeah. So that is really great practical advice. And, in terms of clothing, you're not going to need much because you're going to want to wear the, the clothes that are provided, the hospital
I,
gown.
I hated looking like a little homeless orphan in that gown, like hanging off. But it was just like I am actually. I was in the hospital so long waiting for my transplant, going in and out of in medical and surgical intensive care and things like that. That in one of my healthier moments, I went down to the gift shop and bought university sweats, and so it took some of the nurses a little while to realize I was not on staff. I just got tired of wearing a hospital gown and was
Yeah.
starting to just sport the university sweats and things like that. I have a lot of pajamas, a lot more pajamas than a woman ought to own because of how long I've spent in the hospital. But
Yeah.
that's just one of the things that I do to make myself feel more comfortable, feel more like myself, feel more like a person, and take a little control back.
Absolutely. It's all about control, right?
Mhm.
And even, that beautiful scarf you have, I think putting that around
Mhm.
yourself, and just whatever it makes you feel luxurious and a person and whole. And we are more than our liver disease, right?
Yes.
We are people. And it's really difficult to to pull out that strength in those moments where you feel powerless. You know, we have people coming in and out of our hospital room with, 6 o'clock. It wasn't even 6 o'clock in the morning, and they're taking blood, and
Yes.
I would barely have any sleep because my mind was racing. And so, one of the things for me in the hospital was that I had a 25-day stay. And the reason for that was because I had a psychotic reaction, which is not always a very common thing. And I could see, feel, sense myself being so out of control. I was aware on multiple levels as a person, Maria, stop, what you're doing, stop obsessing, stop screaming, stop. And then the nurse and me going, oh my goodness, how do we deal with this outburst, right? And it was an interaction of medications because as a post-op patient, you're on a lot of anti-rejection. Prednisone, I think, is what kicked it. So prednisone is a very strong medication. It works wonders, but it also can affect people in many, many different ways. So I was in this manic, depressive, anxiety, heightened stage that really, really scared my family. My husband, who would come, of course, during COVID, he could only stay about an hour, and I only had one visitor on my list that could come, and he was not ready to greet me at home.
And that's something of transitions to home. Who's going to receive you when you come home? If home is the environment, are they prepared? Are they in a good place to receive the patient? That's such an important point. That's such an important factor. So how did your husband center himself to be a care partner to you?
Yeah, so it took a lot of mental strength for me because I understood. I was getting messages from my patient my care providers. I had a mental health nurse practitioner. I had a spiritual guidance professional who is denominational and would talk to me about getting all these feelings out and understanding where I was at mentally and expressing all my feelings, my emotions, and the limitations that I was thinking ahead of being at home and what I would do. But then the transition to I was, shopping online at 3 o'clock in the morning in the hospital, Amazon, and my husband was receiving all these packages. And that was me trying to maybe cope, but also think about the kinds of things that I would need at home. So I ordered, special soaps that was going to be, nice on my body, little face cloths that would be gentle because my skin was so dry in hospital.
Yes.
Right.
We've had we could do an entire episode on like me coming out of this latest hospitalization and like what we're going to do about my skin and the, exfoliation and the moisturization and how long it took to get it back into some recognizable shape. I thought it was part hippo, part alligator, part crocodile. It didn't make sense. It was so flaky. I thought like I started a fire. There was so much it was, and people are like, well, you almost lost your life, you really shouldn't be concerned about those things. Those are the things that you're concerned about when you
self-care,
when you get to the other side. You want to become yourself.
You want to become that human again. You want to not smell like a hospital. And I purchased different wedges for because having a big scar on your belly and not moving very well. So, some of our audience members may have had a cesarean section and how difficult that is. And, you're also dealing with a baby that you're caring for. In this situation, the need to just care for yourself, but you still have this major scar in getting around. So
Right.
I ordered, while in hospital, I ordered a hospital bed for home. I ordered a walker. I ordered, all these things that I thought could make my life easier. Now I'm
Did your
privileged.
husband ever take the credit card or the phone away from you at some point?
Never, because I own that credit card, right? Like he tried through the psychiatrist's sort of recommendations to remove my phone. That was a big contention thing with me because we are information people.
Right.
And those of us that are strong, professional individuals and in control of our lives, to release and relinquish in a time where we feel powerless is a very difficult thing. So the compromise in hospital was that I would put my phone over on the side, not at the table, but way and just to know that it's there. They wanted to actually remove it from my hospital bed and put it at the nurse's station. I said, no, I'm not going with that. It's got to be in my room in case I need it, because I was on the phone all night. I was talking. I had contacts and friends in like Switzerland, and the change of time. I'm like, who can I put out? Because now my family is saying, stop with the WhatsApp. It's blinging all night. My brother would say, your husband has to get up at 4:30 in the morning to go to work for 6, and he's visiting you at the end of his shift, and he's exhausted, and he doesn't know how to deal with you. Stop. So I moved on to other people. But
that's why it takes a village sometimes. I would
village.
be looking up guidelines and certainly appreciated that there were test results that were coming in my patient portal, so I could ask the most informed questions possible of my doctor. So that there's that aspect of it too. So let me ask, as you have now been successfully transplanted in our home and are back with your family, what types of things do you do to center yourself and deal with the fears and anxieties that, some of which, still must persist? Because as you said, transplantation is not a cure, it's it's treatment. And so you're still on this journey. So how do you care for yourself at this point?
Yeah. So, at home, there are a lot of medications that need to be managed. And early on, my state of mind was not very good to be able to do that. So so my husband has been accountable, even though I'm the nurse. I feel like I'm supervising what he's doing, but he wants to do that for me. So to take that away from my needs. So every week we sit together and he says, okay, Maria, it's time to replenish your, Monday to Sunday medications, right? And we have a system, and he always double checks and says, okay, so it's 3 of these, 4 of these. And it right now with vitamins and minerals and all the good things that we need to feed in our body, as well as good nutrition. I'm always constantly tweaking, but he and I sit. So we've made it sort of our business. He's taking care of me, and in turn, I'm able to be part of the family and be well enough, and because it's really, really important to adhere to medication.
Absolutely.
So I usually still, taking care of myself, although I've returned back to work probably 2.5 years from my leave, but maybe a year and a half after transplant. And it was really difficult to, go from just taking care of yourself. Year 1 was healing, and then your body, physical. Year 2 was more psychological, mental well-being.
Right.
So I saw a therapist at the same time as I was going through my transplant. My mother was terminal in overseas, and how difficult that was. I did not get to see her. And we would FaceTime. She was in care at the time, and she'd be lying, and she would get weaker and weaker every day and was not able to hold her phone, and I could just see the progression. And it was very difficult, Donna, because I was dealing with my own decline and post, in hospital. So we were both in care, and we were both supporting each other. And I was trying to be strong for her, but she was stronger for me. She was dying and I was trying to live.
Wow.
And it was, she, as mothers, and as support people, we put ourselves aside for others. And so she did pass 3 months post my transplant. And it was almost like I felt that she was hanging on until she knew I was okay.
Absolutely. And you are okay. And I'm so glad to have you as part of our community, and with everything that you bring, the challenges, the struggles, the points of triumph, the points of partnership and connection that you mentioned. Also important and also valuable, and I look forward to personally and as part of GLI being a part of the journey and every transition that you go through in the future. And thank you for everybody who was watching and listening and learning and receiving from this very special Rare Aware series episode. Thank you so much, Maria.
Thank you so much, Donna, and all the best to you. And I look forward to meeting you in person one day soon.
Excellent. I look forward to that.
Thank you.
Bye.
Please be sure to like this video, subscribe, and share your thoughts and suggestions in the comments below. Join us weekly on Wednesdays at noon Eastern Time for more episodes of GLI Live. Check out our website, globalliver.org, and follow us on social media to learn more about the Global Liver Institute and stay up to date with the latest in liver health. Until next time, stay safe, stay well, and stay connected.